text in your questions and we'll answer them in a future episode. Our first question for today is from Kay. Kay is from Michigan and wants to know two things. Does Medicare pay for the new shingles shot? I know it's 2 shots. And also, do they pay for chiropractors? To answer that question, welcome Diane Archer from Just Care and Social Security Works.
Thanks, Laura. So I have some good news on this front. As a general proposition, everybody should be aware that Medicare covers almost all reasonable and necessary services, with the exception, sadly, still of vision, dental, and hearing and long-term care. So that means, good news, that it does cover the shingles vaccine and it does cover chiropractic services. On the shingles vaccine front, it is covered under Part D, which is the Medicare prescription drug benefit. And that benefit is different depending upon the insurance company that offers you that coverage. So if you're in traditional Medicare, you've chosen a plan, and that plan may provide you the shingles vaccine with zero out-of-pocket costs, or it may ask for you to pay some amount out of pocket. And that's the same with a Medicare Advantage plan. The bigger good news, though, is that the Inflation Reduction Act ends cost sharing for all vaccines for people with Medicare. So down the road, you will get the shingles vaccine under Medicare Part D free of charge altogether. With chiropractic services, those are covered under Medicare Part B, which are outpatient services. Medicare Part B is part of both traditional Medicare and Medicare Advantage. And with chiropractic services, that means that you're going to be paying, if you haven't yet paid a deductible, the deductible and then coinsurance of maybe 20%, unless you have supplemental coverage to pick up the out-of-pocket costs in Medicare, if you're in traditional Medicare. But you need to see a doctor who takes assignment, meaning that doctor accepts Medicare's rate as payment in full. If you see a doctor that takes Medicare patients but doesn't take assignment, you may pay an additional 15% above Medicare's approved rate. With your Medicare Advantage plan, there's out-of-pocket cost sharing, and that can vary. I just want to add one other note, which is that, yes, Medicare covers chiropractic services, but it does so for manual manipulation of the spine when your spinal joints are not moving properly. It doesn't cover chiropractors, x-rays or massage therapy or acupuncture, unless the acupuncture is for the treatment of chronic low back pain.
Great. Our next question is, if you don't have health insurance through your employer and you aren't yet eligible for Medicare, what should you do now? How can you find out what you might qualify for through the Affordable Care Act? To answer that question, welcome Aleka from Health Sherpa.
Thanks, Laura. So the great news is that if you don't have insurance through your employer and you're not yet eligible for Medicare, there are lots of options available to you. What you qualify for is really going to depend on your income. So the first option is if you make less than around $1,500 a month as a single person, or about $3,000 a month as a family of 4, you may be eligible for free or low-cost insurance through Medicaid. It's really important to just emphasize that your eligibility for Medicaid depends on your current monthly income. So even if your income might have been a little higher earlier in the year, if this month and you are making less than $1,500 a month as a single person, $3,000 as a family of 4, you are likely eligible for Medicaid. It's always worth submitting an application to be sure. You can, and again, sometimes those limits can depend on the state as well. The limits are a little bit different if you, for example, are pregnant, or if you are looking for coverage for children. So you can submit an application either through healthcare.gov, certainly through a certified partner like Health Sherpa, or you can go to your state Medicaid agency and submit an application directly through them as well. So that's option 1. If your income's a little higher than those limits, or you live in a state that hasn't expanded their Medicaid program to everyone, regardless of to everyone below certain incomes, you may be eligible for coverage through the Affordable Care Act marketplace. And those are private plans that have to meet certain guidelines, for example, covering essential health benefits, offering pre-existing condition protections, free preventive care, all of that good stuff that came along with the Affordable Care Act. Now, with those plans, depending on your income, you likely will qualify for some kind of financial assistance. To give you a sense, last year at Health Sherpa, we enrolled more than 3 million people in coverage, and most of them paid less than $25 a month for their plan. So those plans can be really affordable. Again, if you go to healthcare.gov, again, a certified partner like Health Sherpa, you can find a local trusted broker or a sister who can help you figure out what you qualify for. And they can also help you figure out if you qualify to enroll right now. Right now, we are in what's called the special enrollment period, which means you do need a qualifying life event to enroll. The most common ones are losing coverage in the last 60 days, or life changes like getting married, having a baby, those kinds of things. But the list is long. So if you speak with a trusted professional, they can help you figure out whether you qualify. If you don't, open enrollment starts November 1st, and that new plan would kick in January 1st. So if you don't have a qualifying life event, that's really what you got to keep an eye out for, and you can enroll at that time.
Thank you, Aleka. Our next question is from Tina, who says, if my insurance denies multiple medications prescribed by my doctor, what are my options? My doctor says use the manufacturer's discount coupon, but it only covers a few months. And then what? Diane, do you have any thoughts for Tina?
Yes. Maybe thought number one is what's going on with your insurance, that it's denying so many medicines, and you might want to look into other insurance next time. But thought number two for the immediate is to talk to your doctor about alternative drugs that could replace the drugs that he or she is suggesting or prescribing for you. It may be that your insurer doesn't cover one drug, but does cover another. However, if you actually need the particular drug your doctor has prescribed, you have a right to appeal the denial from your insurance company. The best way to do that is with the help of your doctor. If your doctor sends a letter or writes a letter, or you can draft it for your doctor explaining why the drug is medically necessary for you and no other drug will work, then you can send that back to your insurance company with the denial letter saying, I am appealing, this drug is medically necessary for me. And in usually the vast majority of instances, the insurance company will end up paying. I am so sorry that you have to go through that headache if that's what you need to do. But at least it is one way that you may get your medications covered. The Kaiser Family Foundation has written also about people just literally going online and buying their drugs from a low-cost provider, either in the US or a verified pharmacy abroad. Often the cost of drugs, if you are importing them from abroad for personal use, is just pennies on the dollar of what you pay here. So you might want to look at that. PharmacyChecker.com has a list of pharmacies that are verified from around the country. And while it is true that the FDA still declares it, quote unquote, illegal for people to import drugs from abroad, they've never prosecuted anyone from importing drugs from abroad for personal use. And according to Kaiser, 9 million people import their drugs from abroad in the US.
Absolutely. And also you can look at new options like Mark Cuban's Cost Plus Pharmacy. And I think there's some nonprofit pharmacies pharmacies that cater to low-income folks as well. So if you go to our website, act.tv/care talk, we have links to those options out there. Our next question is from Joy, who says, I've heard Advantage Healthcare is not Medicare. I'm 66 and pay $179 a month for my healthcare. Diane, can you explain the difference between Medicare and Medicare Advantage and maybe help Joy figure out what is the best option?
Absolutely. So I'm just going to keep it really, really simple. What you're paying for right now is the Medicare Part B premium, which covers medical services, whether you're in the government-run traditional Medicare program or Medicare Advantage plan. So either way, Medicare is going to cover, it is supposed to cover all medically reasonable and necessary services. If you're in traditional Medicare, the government pays doctors directly on a fee-for-service basis. You go to the doctors you want to see anywhere in the country. Almost all doctors take Medicare. More than 90% of doctors take Medicare. And your care will be covered in almost all instances. And you will pay a co-insurance and a deductible unless you have supplemental coverage to pick up those costs. With Medicare Advantage, people believe that they have lower costs, and they might, but it's a big gamble, and sometimes they have much higher costs. So, of course, health insurance is not about today. It's about tomorrow and future unexpected needs. And all of us could be diagnosed with a complex condition tomorrow, so we want to protect ourselves. With traditional Medicare, again, if you need to go to Sloan Kettering or MD Anderson or some other specialty hospital anywhere in the country, if you need to move in with a family member and get care where that family member lives, it's all covered. With Medicare Advantage, as a general proposition, your coverage is limited to the area in which you live and restricted to a narrow network of doctors, much smaller, a small subset of the doctors that are covered under traditional Medicare. In addition, you will need, in many instances, permission from the Medicare Advantage plan to get the care that your doctor says you need. So if your primary care doctor says you need to go to Sloan Kettering or you need to go to this specialist, first of all, that specialist or Sloan Kettering needs to be in the Medicare Advantage network, which often it's not. And then if it is, you still need approval in many instances from the Medicare Advantage plan to get that care so that it is covered. And what we have been seeing of late are a lot of reports that there is widespread and persistent inappropriate delays and denials of care and coverage of Medicare Advantage. So people who need a lot of costly care are struggling to get it. Now, obviously, there are some Medicare Advantage plans that are better than others where you can get your care. The problem is we don't know which are the bad actors and which are the good actors. So you may want to go to traditional Medicare if you want easy access to care. There will be higher upfront costs because you'll need supplemental coverage to pick up out-of-pocket costs, but you'll be more likely to get the care you need when you need it without having to go through hoops. In Medicare Advantage, you don't need supplemental coverage, but you'll have copays and deductibles, and you will almost definitely need to go through hoops to get the care you need.
Absolutely. Thanks for that. And please keep calling or texting in your questions, and we will keep answering them in future episodes. And now I'm pleased to introduce our special guest for today, Dr. Eric Sullivan of Doctors for America, who's going to be talking about what to do if you or a loved one gets a scary diagnosis, working within the medical system, getting a second opinion, getting expert care from outside your local provider. What should you do? So welcome, Dr. Eric Sullivan.
Thanks, Laura. I'm really happy to be here and talk to you and your audience about this topic. So just to start with, receiving a scary diagnosis, I think, is something that many of us have experienced personally or through loved ones. And if we haven't, it's something that is always in the back of our mind whenever we're going to a provider. And I think the first thing to keep in mind, if and when this happens to you or a loved one, is to know that whenever you're getting that scary diagnosis, whether it's cancer or a serious infection or anything else very worrisome, is to know that getting that diagnosis is just the start. It's just the beginning of a process. And so whether you're in the hospital or whether you're in a doctor's office receiving that news, just know that, you don't need to have all the answers. You don't need to necessarily have a plan in place, that same day to have all the boxes checked, because there's going to be more opportunities to work with your care team moving forward. Now, that said, that's not to say that you shouldn't be asking questions and asking as many questions as you want. The provider, the doctor should hopefully first and foremost be explaining things to you in layman's terms. If they're giving you a lot of terms, throwing things at you that you don't understand, even if you're kind of like, oh, well, I think I know what that means. If you're uncertain, this isn't the time to kind of be polite and kind of let that gloss over and kind of worry about it later. Absolutely interrupt the physician, the nurse, whoever you're speaking with, to say, hey, I'm not entirely sure what you mean by that. Can you put that in another way, or can you explain that to me in more like common language? That is 100% what the doctor should be doing to begin with. But if they're not, then please get them back on the right track, because you or your loved one understanding what's going on is going to be the first step in taking, the many steps down the path to understanding and treating whatever is happening. And so some of those questions that you may think about asking, if they're not already top of mind, really basic one, how did you come to this diagnosis? Sometimes people know ahead of time kind of, oh, I had this test, I had the CT scan or this MRI, like I knew they were looking for cancer, for example. And so they maybe have steeled themselves, they've done some research to know that this is exactly what was coming or was a possibility. But other times, especially if you're in the hospital or if your doctor is doing kind of more general tests, or you have vague symptoms that don't necessarily lend themselves to like a test that's going to say yay or nay, like this is exactly what you have. The physician may be speaking to you about, well, I think you may have X. And that doesn't always necessarily mean that, yes, 100% certainty you do have X. So a great question to ask the doctor is, how did you decide that this is what you think I have? And, how certain is it that I have this? And that you can even ask them to put it into like quartiles. Like, is it 99 to 100% certain that I have this? Is it like 75% certain, 50%? They may not be able to give you like, a really finite number, like 62%, something like that. But oftentimes physicians can at least give you a sense of, yes, we see a giant mass, like on this imaging report, there's pretty much no other explanation for this than, a malignant cancer. Versus a blood test, they may say to you, well, this blood test is abnormally high, but there may be other reasons for that, and we need to do some additional tests. And those are just two very different scenarios that a physician may have the same kind of tone of voice either way, kind of trying to keep it even keeled, but the level of certainty that they have with that diagnosis may be completely different. So that's a good thing to establish early on if the physician isn't articulating those sorts of things, whether this is something that is absolutely 100% the thing that we're going to be worried about for the next 6 to 12 months, or is this something by the next appointment, we may have some additional information and this was actually a false alarm. And so those are, I would say, where to start with. And then, of course, asking, if you're in a place where you feel like you can, what are those next steps for me? Like, what do I need to do right now as the patient going forward? Do I need to make another appointment with you? If you're seeing your primary care doctor, asking them, do I need to see a specialist? Do you think I should be seeing someone else about this? And how soon should that be taking place? Because again, the timeline of things can be very different depending on what sort of disease you're looking at. And I'll pause there in case there's any questions about that part. Otherwise, I can keep going.
Well, I just wanted to echo what you said, that doctors don't, it isn't always certain what a diagnosis is. For example, after my first scan, there were cancerous, they saw something in my lungs, several somethings, and they proceeded on the assumption that I had lung cancer. And then as I had more tests, it turned out to be lymphoma, a different type of cancer with a very different treatment and prognosis. And I asked my doctor at the time, how certain are you that this is lung cancer? And he said, very certain. I said, is there anything else it could be? And he said, well, it could be lymphoma or these other things, but we think it's lung cancer. But again, more tests can deliver certainty. Doctors can get it wrong. You absolutely can and should get second opinions, especially if this is a serious diagnosis, because the doctor that you start off with, maybe your primary care doctor, this may not be their particular area of expertise. So I just wanted to echo everything that Dr. Sullivan had to say. And Diane had some questions. You're muted.
I just wanted to chime in that going to the doctor and getting a scary diagnosis or any diagnosis can just be beyond overwhelming, even for the most composed human being. It's always scary. And so bringing a loved one or somebody you trust to the doctor's office with you, basically whenever you go, just to be another set of ears, to take notes, to help you ask questions, can really be invaluable. And also, doctors are usually pinched for time. And so even when you ask them, why or what percentage of time or whatever, they might rattle off a string of answers that are just beyond your ability to digest. And so I know my son has taught me to take my phone and use the voice memo function on the phone and tape the conversation so that then you can replay it and listen to it slowly after you leave the doctor's office.
Yeah, absolutely. Oh, go ahead. I was just going to say, yes, 100% bringing family members is a great opportunity whenever you're going to see the doctor. And that's whether you're coming just for your regular checkup, everything's fine, versus, you're anticipating that this might be a more intense conversation with your doctor than usual. Some of my, best conversations have often been when there's been multiple family members in the room with me with a patient, because then, just like you're saying, there's more people to kind of digest and process the information, and your loved ones may think of questions in the moment that you didn't necessarily think of. And I will say, I have zero problem with people recording me when I'm speaking with them, because just like you're saying, like the logistics these days of actually coordinating, getting the adult child or the spouse to actually be there, like to them also take a day off of work to come in, can be challenging. So absolutely, that's a very reasonable request in my mind. I would only say that there are probably some physicians out there, and maybe particularly like older physicians, who may be a little taken aback that someone's like recording them in real time. So just like, at least giving an FYI, like, hey, Dr. So-and-so, like, is it okay if I record this? And I mean, I don't know enough to know whether they could legally like, no, you cannot record me. But I would imagine that almost all of them, especially if it's a significant conversation, would be like, oh yeah, of course, that's fine. But just so that people are aware and not being caught off guard. And the other thing is, like, having people on speakerphone is an extremely common thing that I've seen. And so that's another area where I am always like very encouraging if that's something a patient wants to do.
Mm-hmm. And just to echo what Diane said, when I got my diagnosis, I think my brain kind of shut down. So it is very good to have somebody with you or recording or something, because if you get told bad news, you may not be able to process anymore at that time. So they may be telling you important things and you just can't listen anymore. So be aware of that. And Aleka had a question.
I do. I would love to hear a little bit more about the sort of process for finding a second opinion, or particularly if you're dealing perhaps with a provider in the first line who's just sort of local to you. How do you decide sort of who might be the best person to see about a second opinion? And I'm sure that timelines and things like that factor in too.
Yeah, and I was trying to look up to see if there's any fantastic resources on like the ideal way to go about this. Nothing that I could find that outlines it specifically. So I can give you the way I would recommend a patient if they came to me. And I will say, just as a preface to this, that even though getting a second opinion is something that I think everyone knows is very common, very reasonable. Doctors are human, and everyone has their pride. So, doctors may be like a little taken aback at first, and that's not to say that they should be, but it may happen. But at the same time, medical diagnoses should never be personal in terms of personal to the physician. Like, this isn't, they're not, lining up wins or things like that. This is about getting the best care to the patient, whoever is providing that care. And so I think particularly younger physicians, I mean, I don't know, as a younger physician, I guess I'm a little biased. I would say that they're a little more comfortable. Like, people have often worked in like big team-based settings where you're working in that sort of environment of getting more and more people to chime in about what the course of action is. But just being cognizant that, especially if your physician is someone who, maybe is a solo practitioner, like kind of works on their own, things like that, maybe one of those things where it may be a little uncomfortable at first, but you should absolutely keep at it and pursue that in terms of getting a second opinion, because that's almost always the right thing to do if there's any doubt in your mind about what your next steps are, or even if there's not a doubt and you just want to accumulate a little bit more information. So just a preface there that everyone should be comfortable doing that, and physicians should be comfortable referring their patients out to get second opinions. And then so to get to your question, I would say, from my perspective as a primary care physician, I would hope that my patient would feel comfortable coming to me to say like, hey, I just saw a specialist so-and-so, like my cardiologist or whatever. They told me that I have heart disease or I have heart failure or something like that. And I just would like to know, if what they're recommending is exactly right. And is there anyone that you recommend? So that would be the first step. So if you have a relationship with your primary care doctor, I think that's the best place to start in terms of going about who would they send their family to? And that's a great way to phrase it, is like, hey, I just found out that I have this, or my mother has this. They saw their doctor in so-and-so. And I just want to know, if you were sending a loved one, or if you yourself had to go get care in this area, who would you go to? And by and large, like even physicians new, soon out of training, will often have, an expanding Rolodex of names of people that they trust, that they've worked with, or that they know other people have worked with that are acclaimed in the field, in the area, or even in other areas, that they can get in touch with to say, hey, I have this person here who has similar questions. And I was even, as a medical student, I had a family member who developed a pretty serious medical condition while I was in medical school. And obviously I didn't know anyone at that time. I was not a doctor yet. But I was surrounded by doctors in medical school. So I went to the dean of my medical school. I was like, hey, this is happening. My family lives in this area. Is there someone that you know or that you would recommend? And he, very shortly thereafter, could come up with 3 names to give to me. So plugging into that physician network is going to be a really great option to start with. And like I said, if you have a relationship with your primary care doctor in the area that you're trying to get care, that's going to be, I think, the first place to start. Now, if your primary care doctor is like, hey, this is really specialized, or like, oh, I'm so sorry, I don't know this, you should be able to say, well, I may not know this person personally, but I'm me personally, like if I'm in the recognition, I'd say like, hey, this is like one of the biggest academic hospitals in the area. Your academic hospitals, whatever is close to you, and you don't necessarily have to live in a city that has academic hospitals to access them. Like, for example, I'm in Illinois. We have many academic hospitals here in Chicago, but if you're in like downstate Illinois, maybe you're farther from that, your doctor should definitely still be comfortable picking up the phone and being like, hey, Northwestern University of Chicago, this is something I'm not really super familiar with. Is there someone up there that I should be sending my patient to? Because again, physicians should be accustomed to having that sort of collegiality to reaching out to people, and taking advantage of academic medical centers that, are otherwise known as tertiary care centers, where part of their job is to see the rarest of the rare conditions and to have that expertise. They should have people who can, at the very least, point you in the right direction, say like, yeah, actually, this isn't something that we're the best at, but hey, this hospital over here, like they are actually really phenomenal in this area. So going to those resources, going to the places where there's such a collection of knowledge that you can kind of feed off of that and then turn that into your second opinion is another good option.
Mm-hmm. And also, one of the things that I did, I immediately hit the Google, and some information you find online will be more reputable than others, but I found some support groups of patients, and then I looked at who they recommended, who they thought were the experts in for what I was looking for, and people that were in my region, not necessarily in my city, because Las Vegas doesn't happen to, it's kind of a medical desert. So you can go through support groups of people with your medical condition too, and you will find patients will advocate for this. This doctor was great. This doctor was really helpful. And with some advanced conditions, people will fly all over the country to get access to the very best care. So if, at least for a second opinion initially, it may be worth talking to one of the best doctors in the country if you can find them, if you can at least get them on the phone or via email.
Yes, definitely. And the thing to know is that even if you're talking to a provider in another state or want to have a visit with them, for example, like a telehealth visit now in the age where we have telehealth visits easily accessible for many, as was previously noted, there's in-network, out-of-network things for people that can produce barriers. But for that initial visit, for that conversation, for just a regular office visit, even if you're going out of network, number one, talk to your insurance company. They may be there may be things that they can do, like God willing, to help you with that. But even if not, that initial conversation with an expert, relatively speaking, shouldn't break the bank. You should be taking in the orders of, tens, $100, $200, hopefully, to just have a telehealth visit. And if that's enough to just like get you a lot more information that you need, that's hopefully like money well spent. And again, if you're someone who's completely uninsured, then talking with the facility about charity care, different options, financial plans that can be utilized in those situations. So just know that though that initial conversation hopefully shouldn't be the thing that's going to be this gigantic cost when it's coming at the beginning of the process, when you're really just hungry for a lot of information and figuring out what those next steps are.
Mm-hmm. And do you have any last thoughts for our audience for if they get this bad news?
I think my last thoughts would just be circling back to what I said at the beginning, and what many of you have alluded to. I think the hardest thing for people to do in this situation is to feel like they got all their questions answered by the time that they left, and just being okay with that, and not to the extent that like if the doctor was ignoring questions, like that's a huge red flag. Please don't see that doctor anymore. But to the extent that you're just feeling like, oh my God, there's like so much still left to do. I know there's like still a lot on the to-do list that I like want to fill out. And just again, reminding yourself, turning to that loved one to be like, hey, let's go and see this doctor again in a week. Like, let's schedule a telehealth visit to continue this conversation. Like, your physician should be comfortable saying, hey, I can see that, you still have more questions. We're out of time for today, but, I'm available again next week, or I'm available, this day, by phone. Let's schedule a telehealth visit. Just knowing that you can keep that conversation going when when you first get this diagnosis. You don't have to have everything figured out that same day. And your physician should be actively reminding you of that, and just reminding you that, this is a process, not like a singular event that you have to have everything figured out that same day.
Absolutely. Well, thank you, everybody. This is Care Talk. Please keep calling and texting in your questions, and we'll answer them in future episodes. And thanks for spending time with us today.